Hello, today we've just come back on day 2 of the Seattle study tour from visiting Seattle's Children's Hospital, founded over 100 years ago by a group of women, funded and paid for by a group of women who wanted to make sure they could extend access to families who had very sick children and that be paid for. That spirit of supporting this hospital through generous donations has continued for the entire time. It's a children's specialist hospital. We've spoken about Harborview, the hospital we visited on our first day, being the take center for trauma and including pediatrics. So Seattle Children's does specialist care for children, but not trauma care. One remarkable thing I think that the cohort took away from the Seattle Children's Hospital is their attention to transforming healthcare via what they call their continuous performance improvement, their CPI program. And many of the questions that were asked of the Director of International Affairs today was around CPI and where did it evolve and where did it come about. So CPI was the brainchild of one of the vice presidents of Seattle Children's more than 30 years ago, so someone who was an administrator. And it's grown from that point on in the 30 years, and probably especially in the journey they've been on for the last 7 years, into the way that they do business around here. So it's inextricably linked to their culture. It's how they do everything. Because patients and families are put first and at the center of everything that they do at the Seattle Children's Hospital, then they believe that to have a process that's continuously looking at improving and standardizing their work so that they get the best outcomes is the way forward. CPI is so important to them that all staff, and this hospital employs more than 6,000 staff, 1,000 of whom are doctors that have contracts in several or attachments to several different hospitals in the region. That part of your induction to this hospital is to understand CPI. And they've done it through making it accessible by a number of modules that you have on the internet, by an induction training program onto what they call the 5 S's. And we'll talk about the 5 S's later on in terms of quality improvement, what they stand for. They also, when the CPI team, which is the formal team that's responsible for helping clinicians put into practice their new ideas, was formed, they consciously took staff who were already enrolled in the hospital, so nurses, doctors, administrators, allied health professionals who had a history of working at Seattle Children's Hospital, and developed them to be the continuous program improvement office team. They currently have a team of 10 people doing it, and the thinking behind that was if you were more likely as a clinician or non-clinician to listen to someone who you viewed as a colleague helping you make a process better than by bringing in an external consultancy. So I think that's the lesson that many of the delegates felt that we could take back in the UK, where the temptation is when you want to do something like lean or process improvement is to bring in consultants. What they did was build capacity within their team. Holding people to account for CPI is also really important, and what the group heard today was that it's part of the annual evaluation. Everyone has to pass an evaluation. Actually, this is the month of the evaluation we heard today. And part of the evaluation is dedicated to CPI, how you participate in it, what you do about it, how much you engage with it. Interesting thing about the culture also at the Seattle Children is this culture of caring for each other, which goes directly to the work that we do in the UK when Michael West, Donna Willis and the team speak about collective leadership. This attention to compassion and being kind to the people who are working here, your co-workers. Many stories of how co-workers go the extra mile to help each other out. Many examples of how the organization sets about trying to hire people who have the values that would provide health care to children and their families, and that part of that is smiling and trying to be happy about each day. They do other types of incentives, which are well documented around the hospitals. If you look at the symbols of the culture, the visible artifacts, you have posters again. We saw some of them at Harborview, but at Seattle Children's, they're slightly different. So the posters demonstrate hand hygiene on each ward, the monthly poster, and by professional role. So they would show RN for nursing, MD for doctors, and so on. What percentage to 100% on a colored bar graph each professional role complied with the hand hygiene. And they have a mystery shopper that goes around documenting this. Like Harborview, Seattle Children's, being a specialist hospital, serves the 5 states, what they call WWAMI. So that's all of Washington, Alaska, Montana, Idaho. And so therefore they get, part of that is they have a very diverse population. 45 languages are spoken here at Seattle Children's Hospital. And so wayfinding, which is their term for saying how we help people find their way around here, they sort of evolved when their patient population started to come, quite a lot of the cases from Alaska, for example. And they were in a phase of redesigning the murals and the connecting buildings. They went with stories and symbols from the Pacific Northwest. So you will find river, mountain as names of units, for example. And that is because they have murals that connect the different parts of the hospitals, and it's done in the language of children so that children can be the wayfinders for their parents so they know where they're going. Seattle Children's Hospital have a great culture of people wanting to volunteer here. And more than 400 people have been working here at the hospital for more than 25 years. But they have 100 volunteers strong at any one time. They don't use all of them. But they spoke of an example of making it accessible. So every process they have at the Seattle Children's Hospital is subjected to standardization. So they did the same for the volunteers. And what was remarkable was within 15 seconds, they had so many people volunteer. And the volunteers come from all sorts of walks of life. I guess we can empathize with the fact that many people want to work in a children's hospital. We see children as being the most vulnerable when they're patients. But many of them are people who are pre-med or pre-nursing who want to come and give their time and then later sometimes come back through their medical school as permanent members of staff. If that happens and people were part of the pre-med at Washington State University based in the Seattle Children's Hospital, then they also are introduced to continuous process improvement, CPI, at the point of their medical education, which was another striking point that delegates took away from the visit to Seattle Children's Hospital. So all in all, a children's hospital, 6,000 staff. We have many children's hospitals doing great work back in the UK and around the world, but this is one that will stand out in people's minds for the fact that every aspect is subjected to continuous process improvement and standardization, and the evidence of that is everywhere. They're very realistic. They talk about having to deal with the same barriers to change that we might have to in the United Kingdom. They talk about the fact that if they have 1,000 doctors who work at the Seattle Children's Hospital, that sometimes those may not always come quickly to the new habits, but that because of the very flat hierarchy in which the teams work, so again, speaking to the value of team working, that it's made very much easier for the doctors to be part of the multi-professional team and all look at CPI through the same lens. There will be people who are reluctant or who are more cynical, but everyone is encouraged to participate.